Canadian Cardiovascular Society Guidelines on Perioperative Cardiac Risk Assessment and Management. Heart disease remains a leading cause of mortality worldwide. It poses a significant threat to patients undergoing non-cardiac surgery. This makes it essential for healthcare providers to identify patients at risk. Complications related to heart health can arise during or after these procedures. Cardiac risk assessments should be done by experienced clinicians, and risks should be communicated in clear quantitative terms. The CCS guidelines underscore a critical aspect of perioperative care risk stratification. Preoperative biomarkers. One important tool in this assessment is the measurement of NT-proBNP levels. Avoid using echocardiography or coronary CT angiography for routine cardiac risk estimation. Measure BNP or NT-proBNP before surgery in patients aged 65 or older. Those aged 45 years, 64 years with cardiovascular disease, or with an RCRI score greater than or equal to 1. NT-proBNP and BNP levels are key predictors of outcomes. NT-proBNP levels greater than 300 ngl and BNP levels greater than 92 mgl indicate higher risk. Accurately identifying at-risk patients is the cornerstone of effective perioperative cardiac care. Cardiac risk assessment is advised for patients over 45 or younger patients with significant cardiovascular disease. For emergencies, proceed with surgery without delaying for cardiac assessment. The Revised Cardiac Risk Index (RCRI) is invaluable for risk stratification. It considers 6 predictors of cardiac risk. Each factor is assigned 1 point. Use the Revised Cardiac Risk Index, or RCRI, to predict complications. RCRI factors include ischemic heart disease, heart failure, and high-risk surgeries. Medication management is crucial in perioperative care, especially for patients with cardiac conditions. Let's look at a few common ones. Aspirin or ASA should not be initiated for cardiac event prevention. Continue ASA only for patients with recent stents or undergoing carotid surgery. Beta blockers. Do not start or continue beta blockers or alpha-2 agonists within 24 hours before surgery. Alpha-2 agonists. Avoid preoperative initiation due to lack of benefit and risk of hypotension. ACE inhibitors and ARBs. Withhold 24 hours before surgery to reduce intraoperative hypotension risk. Statins. Continue for patients already on statins as evidence suggests benefit. Calcium channel blockers. Not recommended for routine initiation due to limited benefit and potential side effects. Smoking cessation. Encourage and facilitate smoking cessation preoperatively to improve outcomes. Coronary revascularization. Do not perform prophylactic coronary revascularization pre-surgery as it does not improve outcomes. Postoperative vigilance, monitoring, and managing high-risk patients. Postoperative care is just as critical as the surgery itself, particularly for patients identified as high risk for cardiac complications. The CCS guidelines emphasize the importance of close monitoring and proactive management during this vulnerable period. For high-risk patients, the guidelines recommend monitoring ECGs and troponin levels daily for 72 hours to detect asymptomatic myocardial injury. This allows for the early detection of any abnormal heart rhythms, which can be a sign of cardiac stress. Beyond monitoring, proactive management of pain, fluid balance, and blood pressure are crucial. Uncontrolled pain can put extra strain on the heart, while fluid overload can exacerbate heart failure. Maintaining optimal blood pressure is essential to ensure adequate blood flow to the heart and other vital organs. Postoperative delirium. Postoperative care shouldn't be solely focused on physical recovery. Addressing the patient's psychological well-being is just as important. Anxiety and stress can negatively impact cardiac health, so providing emotional support and clear communication can significantly contribute to a smoother recovery. For patients with myocardial injury post-surgery, initiate long-term ASA and statin therapy to reduce mortality. Shared care management narrator. For high-risk patients, a shared care approach involving multiple specialists can improve outcomes. These guidelines help optimize perioperative care with evidence-based strategies for assessing and managing cardiac risk.